In your morning medical news, it is the last week of February, and before American Heart Month ends, experts want to bring awareness to a condition that many people may have without even knowing it. Mandy Gaither explains what to know about hypertrophic cardiomyopathy, the most common genetic heart condition in the U.S.
It's often called a silent killer. Hypertrophic cardiomyopathy is often a genetic condition affecting about 1 in 500 people in the U.S. It causes a heart muscle to thicken, making it harder to pump blood.
The thick heart muscle itself create rhythm issues. So these patients' heart can go out of rhythm into some deadly heart rhythms sometimes and can cause sudden cardiac death.
Dr. Saeed Al-Sadawi with Mayo Clinic says only a fraction of people with this condition are actually diagnosed. He says symptoms can include shortness of breath, chest pain, lightheadedness, dizziness, or passing out, especially during exercise or other exertion. But in many cases, he says there are no signs until a sudden cardiac arrest.
Unfortunately, we keep seeing either people not seeking attentions, physician not diagnosing it on time, or not recognizing the diagnosis despite having the appropriate imaging.
If you have a first-degree relative, like a parent with this condition, Al-Sadawi says that raises the risk you'll also have it. So he says genetic testing is important.
Now, the challenge becomes we have people who have no family members who have the condition, and they have no symptoms. So how do we know somebody has hypertrophic cardiomyopathy? This is a big area now of investigation.
While that research continues, Al-Sadawi says patients should advocate for themselves, and if symptoms are present, seek medical help.
If diagnosed, there is treatment for hypertrophic cardiomyopathy that can allow the patient to live a normal life. That includes medication, surgery, and in severe cases, heart transplantation. Wisconsin kids have the second lowest measles vaccination rate in the nation, according to the Department of Human Services. Vaccine rates are down from 88% in 2013 to 81%. That is as the number of measles cases continues to rise across the country. Since late January, 93 cases have been confirmed in 8 states. There have been no confirmed cases in Wisconsin. Scientists in China have detected a new strain of a coronavirus in bats. According to a new study, the newly identified strain can infect humans in a way similar to COVID-19. Right now, there are no reported infections in humans.